One, according to adult learning principles, what is the most effective approach when training experienced healthcare professionals in hyperbaric medicine? A. Lecture-based instruction with minimal interaction. B. Self-directed learning that builds on prior clinical experience. C. Strict adherence to standardized curricula without flexibility. D. Passive observation of hyperbaric chamber operations. 2. When developing a competency-based curriculum for hyperbaric technicians, which component should be prioritized first? Evaluation methods and assessment tools. B. Learning objectives aligned with job task analysis. C. Scheduling of training sessions. D. Selection of audiovisual equipment. 3. Which evaluation method is most appropriate for assessing a trainee's ability to recognize and respond to a patient's seizure during hyperbaric treatment? A. Written multiple choice examination. B. Simulation-based scenario with debriefing. C. Self-assessment questionnaire. D. Peer evaluation form. 4. Under UHMS, Undersea and Hyperbaric Medical Society guidelines, what is the minimum number of hours of didactic education required for hyperbaric technician certification? 40 hours. B. 60 hours. C. 80 hours. D. 100 hours. 5. When mentoring a new hyperbaric safety director, which leadership quality should be emphasized most for regulatory compliance? A. Charismatic personality and enthusiasm. B. Attention to detail and systematic documentation. C. Aggressive decision-making and rapid implementation. D. Flexibility in applying safety standards. 6. When implementing a preceptorship program for hyperbaric staff, what is the recommended minimum duration for competency development in chamber operations? A. 1 to 2 weeks. B. 4 to 6 weeks. C. 3 to 6 months. D. 1 year. 7. What is the primary purpose of formative assessment in hyperbaric training programs? A. To assign final grades and certification status. B. To provide ongoing feedback and guide learning progress. C. To compare trainees against national benchmarks. D. To satisfy insurance requirements. 8. Which communication technique is most effective when explaining complex hyperbaric physics concepts to patients with limited medical knowledge? A. Using technical terminology to establish credibility. B. Providing detailed mathematical calculations. C. Using analogies and visual aids to simplify concepts. D. Avoiding the topic to prevent patient anxiety. 9. NFPA 99 Healthcare Facilities Code requires hyperbaric chambers to comply with which safety standard? NFPA 101 Life Safety Code only. B. NFPA 99 Chapter 14 Hyperbaric Facilities Requirements. C. General Industrial Pressure Vessel Codes. D. No specific NFPA standards apply to hyperbaric facilities. 10. When conducting a needs assessment for a new hyperbaric training program, which data source provides the most valid information? A. Online surveys of randomly selected healthcare workers. B. Job task analysis from current hyperbaric facility operations. C. Assumptions based on the program director's experience. D. Marketing materials from equipment manufacturers. 11. Which adult learning principle is violated when mandatory training sessions are scheduled without considering participants' work schedules and personal commitments? A. Readiness to learn. Self-concept and autonomy. Prior experience. D. Problem-centered orientation. 12. What is the most appropriate method for evaluating a hyperbaric physician's clinical decision-making skills? A. Written examination on treatment protocols. B. Chart-stimulated recall with case presentations. C. Attendance records at continuing education events. D. Patient satisfaction surveys. 13. According to the Joint Commission standards, how often must hyperbaric facility staff complete fire safety training specific to the hyperbaric environment? Annually. Every 2 years. Upon hire only. D. Quarterly. 14. When developing learning objectives for a hyperbaric safety course, which format follows the SMART criteria most effectively? A. Understand chamber operations. B. Learn about hyperbaric complications. C. Demonstrate proper fire suppression techniques in 100% oxygen environment within 2 minutes. D. Become familiar with emergency procedures. 15. Which mentoring approach is most effective for developing critical thinking skills in hyperbaric trainees? A. Providing direct answers to all questions immediately. B. Using Socratic questioning to guide problem solving. C. Discouraging independent research to maintain consistency. D. Limiting trainee exposure to complex cases. 16. What is the primary regulatory authority for clinical hyperbaric facilities in the United States? A. FDA, Food and Drug Administration. B. OSHA, Occupational Safety and Health Administration. C. State health departments and accrediting bodies. D. UMass, Undersea and Hyperbaric Medical Society. 17. When assessing learning transfer, which measure indicates the training program's effectiveness most accurately? A. Trainee satisfaction scores immediately post-training. B. Written test scores on the final examination. C. Observable behavior change in the workplace. D. Number of continuing education credits awarded. 18. Which instructional strategy best supports kinesthetic learners in hyperbaric training? A. Reading technical manuals independently. B. Watching video demonstrations. C. Hands-on practice with chamber equipment. D. Listening to recorded lectures. 19. Which assessment technique is most effective for evaluating a trainee's understanding of decompression sickness pathophysiology? A. True-false questions on basic facts. B. Concept mapping to demonstrate relationships between physiological processes. C. Matching terminology with definitions. D. Fill-in-the-blank completion exercises. 20. When documenting competency assessment for hyperbaric staff, which element is essential for regulatory compliance? A. Subjective impressions of performance. B. Objective criteria with observable behaviors and outcomes. C. Peer comparison rankings. D. Self-reported confidence levels only. 21. According to the UHMS Certified Hyperbaric Technologist CHT examination, what percentage of questions typically focus on safety and emergency procedures? A. 10 to 15%. B. 20 to 25%. C. 30 to 35%. D. 40 to 45%. 22. What is the most critical factor when selecting evaluation tools for a hyperbaric certification program? A. Ease of administration and scoring. B. Validity and reliability of the instrument. C. Cost of materials and software. D. Popularity among other training programs. 23. Under CMS, Centers for Medicare and Medicaid Services, guidelines, hyperbaric oxygen therapy must be delivered under which conditions for reimbursement? A. In any healthcare setting with a chamber. B. Under physician supervision with approved indications. C. By any certified healthcare provider. D. Without documentation requirements. 24. When providing corrective feedback to a hyperbaric trainee, which approach is most constructive? A. Public criticism to set an example for others. B. Private discussion focusing on specific behaviors with improvement strategies. C. Written warning without verbal explanation. D. Delayed feedback several weeks after the incident. 25. Which curriculum design model is most appropriate for competency-based hyperbaric education? A. Subject-centered design organized by topics. B. Outcome-based design focused on performance competencies. C. Chronological design following historical development. D. Instructor-centered design based on teacher preferences. 26. What is the primary purpose of conducting a gap analysis in hyperbaric training program development? A. To identify deficiencies between current and desired performance levels. B. To compare salaries with national averages. C. To justify budget increases. D. To eliminate experienced staff members. 27. Which type of assessment is most appropriate for high-stakes certification decisions in hyperbaric specialization? A. Formative assessment during training. B. Summative assessment at program completion. C. Informal observation by peers. D. Self-assessment by the candidate. 28. According to UHMS indications, which condition is an approved use for hyperbaric oxygen therapy? A. Alzheimer's disease. B. Autism spectrum disorder. C. Necrotizing soft tissue infections. Multiple sclerosis. 29. When establishing a quality improvement program for hyperbaric services, which metrics should be monitored continuously? A. Patient satisfaction surveys only. B. Adverse events and critical incidents. C. Staff vacation schedules. D. Equipment purchase costs. 30. Which communication strategy is most effective during a hyperbaric emergency situation? A. Closed-loop communication with readback verification. B. Shouting commands without confirmation. C. Nonverbal gestures only. D. Written notes passed between team members. What is the required frequency for hyperbaric chamber pressure vessel inspections according to ASME, American Society of Mechanical Engineers standards? A. Monthly. Annually. C. Every 3 to 5 years depending on classification. Only when malfunction occurs. 32. When developing a mentorship program for new hyperbaric nurses, which structure promotes the most effective learning outcomes? A. Random pairing without consideration of experience levels. B. Structured pairing with defined goals and regular check-ins. C. Group mentorship with no individual guidance. D. Self-mentorship through online resources only.